You're watching KARK 4 News, telling the stories that matter to Arkansas for 60 years.
Welcome back. The old dentist saying goes, you only have to floss the teeth you want to keep, right? Well, the American Dental Association recommends flossing once per day to keep teeth and gums healthy.
And with that thought, our favorite dentist is in the house, Bryan Dunlap. Dr. Dunlap, first off, thank you. Second off, I hate flossing. I'm just going to throw it out there.
Hope your mom isn't watching.
I knew that about you, actually.
I know.
Yeah.
You're my dentist. You know that.
So what can we do to make flossing more enjoyable for people who hate it?
Well, first of all, this is not exactly a real exciting topic. We know, flossing. Everybody tune in. We're talking about flossing, but extremely important. That is not a, it sounds like a joke. It's not. Only floss the ones you want to keep. So we got a lot of things that if we obviously would like you to floss, but if you want some help, there's some aids that might make this
all right,
easier.
so you've got the traditional floss, the wax line that you stick between your teeth.
Right,
and
everybody hopefully knows what that is, I hope.
And then these things came out. These are just the easy throwaways that you can kind of use it on your own.
They're nice, the little handles, and they make it a little bit easier to get back in the back teeth for some people, and also those are great. Again, I'm going to say this several times. There's a lot of people, whether it be they have disabilities or elderly or other things, that they just can't feel like they floss very easily, and those little picks are much easier to handle. So that's one nice thing.
Okay, and I've never seen this. I know Sonicare makes an outstanding toothbrush with the vibration. They also make this. How does this work? This
is a rather new product. It's come out in the last couple of years. It's called an air flosser, and what it does is it uses the same kind of technology as Sonicare toothbrush does, which is a fantastic product. But this actually, kind of blows air and water and whatever you decide to put in the air flosser. You can use mouthwash and other things to really kind of blitz between those teeth and get a lot of food particles and bacteria out of there. And it actually does a great job. I'm pretty impressed with that new product.
And there's also a water pick that you can shoot water between your teeth.
I think the water pick is kind of a more old school method of the Sonicare. I think the Sonicare is probably a better product as far as going to get more of the job done.
But the rule of thumb is, regardless of how you do it, do it.
Yeah, once a day, guys. It's not like brushing. We don't say you do it. You have to do it twice a day, and I've got a lot of people that do that. But once a day, if you did it once a day, you'd probably be doing better than about 80% of the public.
Wow.
Unfortunately, out there. But I tell you what, if you do it, it just makes a huge difference on your gums. They'll feel so much better, and you'll have easier checkups for sure.
Okay, go floss right now. Take care of it. You'll feel so much better. Dr. Dunlap, thank you so much. You're great to have in, and he's answering your dental questions right after this. If you have a question, go to our KARK Facebook page and ask right now. He may be answering it after the break.
Well, I wish that there was a camera rolling during our breaks. This guy was getting bombarded from questions with us.
So many dental questions.
Should you brush your tongue? How do you get rid of morning breath? But the more important questions here.
Right. We'll do some
these guys.
Facebook questions.
There you go. Let's go with Felicia. I had to get a root canal and a crown. My dentist said, sent me to a specialist to get the root canal. Why couldn't he do the crown as well?
Well, that's a good question. The specialist is called an endodontist, and that specialist is trained just to do root canals, typically difficult root canals. So they don't do anything but root canals all day long. Sounds like it's really exciting, but no, that is why that dentist did not do your crown. They're not really, it's not what they do.
And
pretty
now,
simple answer. Let's
go to Mary's question. Mary asked, can getting your wisdom teeth removed change the shape of your face? This is interesting.
Yeah, well, I think it's kind of a trick question. The only time I've seen it change the shape of your face is when you swell afterwards. So it does change the shape of your face.
Chipmunk cheeks.
Because you do have a little bit of the chipmunk cheeks. I don't think you're going to, unless the orientation of your wisdom teeth was kind of a little bit out of line and a little bit towards the facial, I don't expect the wisdom teeth, getting them out, to change your face shape a whole lot. Now, if you did lose some molars in front of the wisdom teeth, yes, you could start seeing a little bit more of a sunken in look. I don't think you'll see a dramatic face shape change from wisdom teeth removal, generally.
Okay.
So those are all the questions from you guys, but let's let you answer one of Greg D's questions. Should you brush your tongue?
I say yes, you should brush your tongue.
Okay.
And in extreme cases, if you feel like you have some bad breath problems, one thing you can is try that tongue scraper.
The tongue scraper. And that's not too rough on your tongue.
No, and that, because sometimes if people have bad breath, it's because of sulfur-producing bacteria that are on your tongue.
Okay.
And the tongue scraper can help that.
And our last question, actually, Greg asked, why can't Listerine make a coffee so that would just eliminate all of our problems? We'll let you sit on that.
That's out of my league.
If you can do that, I'll buy stock in it.
Okay.
Absolutely.
Okay.
I'll have that in 2 weeks when I come back.